When using oxygen, you want to make sure that you have the right canister. So you need to make sure that the bottle is labelled and that the canister is white with a black top. You also want to make sure that it has 1 port and 2 pinholes for the regulators to attach to. In terms of safety, you want to make sure you can have it lying on the ground as much as possible, as they're high pressure and you don't want to knock it over. When attaching the regulators, you want to make sure that the Bodac seal is okay, and you slide down the side and then twist it in nice and tight. To make sure that it is a full canister, you quickly turn the oxygen on a bit with the flow rate off and make sure that the pressure gauge is either in the green or above 2000. To make sure that it's working, you can turn the flow gauge slightly a quarter turn and feel that that's going. When you're finished with the oxygen, you turn it off and then you just want to let it bleed before disattaching the regulator. There you go. Indications of when to use the oxygen are when patients are in shock, either ischemic or hypoxic, have low O2 saturations, or carbon monoxide poisoning. A useful adjunct to use would be the nasal prongs. These can be used by attaching them to the bottom of the flow rate on the regulator, and can be put on the patient by just connecting them under the nose, around the ears, and then can just be tightened using that seal. When using the nasal prongs, you want to make sure that you put them on at a flow rate of either just 2 to 4, otherwise this can become mildly painful. These are good on patients who are mildly breathless or hypoxic, as it delivers oxygen at just 20 to 40% litres per minute. They're also handy as they're non-invasive and you can use on patients who are vomiting or as well as other masks. Before using the suction, you need to test that everything works. So to do this, you check all the tubing and is in place and that the seals are good. You also want to make sure that it's able to suction at its maximum potential. So to do this, you crimp the tubing like this and hold it tight. Turn it on max and hold down the test button, and you want it to reach the top here, and that shows you that it's able to function at maximum potential. Perfect, so that's all good. Another way to check as well is just to put your finger over the hole and just feel that there, and so that's suctioning well. Indications of using the suction would be when there is fluid occluding the patient's airway, and contraindications would be that it can induce vomiting, bradycardia, hypoxia, soft tissue trauma, as well as laryngospasms. When suctioning the patient, you need to make sure that they're in the recovery position, and you need to be careful that you only insert the catheter as far as the eye can see. When suctioning, you want to suction in circular motions on the way out. You don't want to suction upon entry. So do this, you turn it on. Boom. So you don't want to have your finger over the hole while you enter. And then on your way out, you want to begin suctioning by putting your finger on the hole and slowly circulate on the way out like that. You don't want to suction for longer than periods of 10 seconds as well. In the case of suctioning in a moving vehicle, there is a soft catheter you can use rather than the rigid one, just to protect the patient from palate damage. Soft catheters can also be very helpful if you need to suction through OPAs or ET tubes. So we're just going through the first response kit. So in the top pocket here, you have adult and pediatric blood pressure cuffs, a glucose kit, stethoscope, tympanic temperature, shares, as well as a pupil torch. This pocket's just miscellaneous, as well as a bit of PPE. Right hand side is a trauma pocket, so this includes bandages, tourniquets, steri strips, gauze, and it's a bit more saline solution. Top left hand pocket contains ethichloride solution, emesis bag, and lanyards. And bottom left hand pocket contains oral and IV glucose and glucagon. Opening up the bag, the top pocket here is a medications pocket, including antihistamine, methoxyfluorine, Panadol, and ibuprofen. Just got to make sure you're checking the expiry date on those. Pocket down from that is an airways pocket, so they have NPAs, OPAs, laryngoscopes, a biohazard bag, forceps, as well as lubricant. Again, just got to make sure they're all there. Down from that again is more medications, including adrenaline, salbutamol, and ipratropium bromide. Check for expiration dates. And the pocket next door to that includes your acute face mask, your nebulizer face mask, nasal prongs, and oxygen tubing. Into the big pocket, you have 3 bag valve masks. These should all include a filter, PEEP, extra tubing, a reservoir bag, and you've just got to make sure they're all intact and clean before you use them. And then in the wider bag, you have a towel, an LMA kit, an IV kit, splints, a sharps container, sodium chloride, as well as slippery sands. And that is the first response kit. So we just want to check the LifePak 12. So first you want to turn it on, and then you just want to put it into manual mode, and just run a user test to start off with. While the user test is running, you just want to make sure you've got all the equipment. So you can check the printer paper in here by just pulling that out and make sure it's full, so there's enough for today, otherwise you need to replace that. In the left pocket you have your test load, your razor, your 12 lead, your pads and cables, as well as drugs like GTN and aspirin. Around the back you have your ECG dots, an extra battery, as well as extra printer paper. And while we're here you can check the life of the batteries just by pushing the button on both of those, and they're both full. In the diagnostics pocket you have SpO2, an ETCO2, an automatic blood pressure cuff, which still works the same as a manual blood pressure cuff and takes the systolic and diastolic pressure, as well as a 3 lead. Cool, so you just want to check that, and that says the user test has passed, so the machine's all good to go. Next you want to do your manual checks, so you want to check the 3 leads working. So first I'll just turn the volume up on the heart rate, just so you can hear that. I'm just going to turn it up to medium. Then I want to change the view so I can see what's happening with the ECG and the SpO2. And I also just want to turn the size up so it's more obvious. There we go. When applying a 3G to people, you want to make sure that your black and white leads are opposite and the white goes on the right. You want to make sure you're placing these just below the clavicle. So white to the right under the clavicle, and the black one just on your left, again just under the clavicle there. And the bottom two, you want to make sure the red lead is opposite the white and you're placing these just above your hip bone. So red opposite white, and green opposite the black. Again just above your hip bone. Now I can hear the R wave. If you want to correlate the machines to your body, you can just palpate your pulse, and then you should be able to feel a pulse per R wave on the thing, and that just means that your body is matching the machine and it's working okay. To use the SpO2, you just place that on your finger, and that should measure your blood oxygen levels. Also, to get an ECG reading, you can print here. This just makes it easier to read off the paper, and to stop that you just press the print button again. Also good to keep for record. If you won't need to use the ETCO2, you can plug it in, but it needs to be screwed into this flap here. And this can be attached to breathing apparatus, and this will measure the patient's expired CO2 as well as the patient's rest rate. Just turn the volume down. Finally, to measure the shock, we've got a test load attached, and I'm just going to select the charge volume value to low, just for the video. To charge, you hit that. And to administer the shock, you just press shock. If you ever need to disable a charge while it's charging, you just need to hit the center button here, and that will disarm the shock there. And that is the LifePak 12. So today we're going to a 65-year-old male with chest complaints and is now unconscious. Tom is my offsider, and we're wearing our PPE. When I arrive at the scene, I will check for hazards and possible exit routes. I'll also assess the patient, and I'll assess the response, the airway, and the breathing of the patient. Hello sir, how are you? Are you okay? We're paramedics, we're here to help. There's been no verbal response. Hello? And no response to pain as well. I'll check for breathing. Here's airway. Here's a GCS of 3. I'll look, listen, and feel for breathing. He's not breathing. If you could start chest compressions, please. AET to comms, requesting an R50, please. I'll place the pads on the chest around Tom to make sure we minimise time off the chest.
Analyzing heart rhythm. Do not touch the patient. Shock advised.
Back on, please.
Charging.
Place a towel under the patient's neck
Stay clear
to
of
help
patient.
maintain the patient's airway.
Deliver shock now. Press the orange button now.
Everybody clear?
Shock delivered.
Back on, please.
Pause.
I will also put
Start
OPA in the
CPR.
patient's mouth. I will do this by measuring from the mouth to the edge of the mandible. I'll place this in upside down and rotate it 180 degrees. There we go. Complications of the OPA can induce the gag reflex, in which case you'd use an NPA. You'd want to make sure these are fully looped up. Again, measure from the nose to the edge of the mandible. And you can insert this perpendicular to the face. And if you come into any complications, just give it a little twist. You wouldn't want to use an NPA in a patient with facial trauma, in case you can insert that into the incorrect cavity. I will now connect the oxygen to the oxygen tank at a flow rate of 15 and 100% oxygen. If you just want to count back from 25.
25, 26, 27, 28, 29, 30.
I'm using a CE grip to help maintain a good face valve bag mask seal, as well as using a 30:2 ratio. When using this, it's important to make sure the oxygen bag is fully inflated to make sure the patient's getting good oxygen flow. And a good way to check that you're getting good oxygen flow is to see the chest rise and fall. When oxygenating, try to only use a third of the bag valve. Being careful not to overinflate the chest, causing or gastroinflation as well as barotrauma. Tom and I will swap positions after the next round of the AED.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
So we'll start CPR again, if you can just count my compressions. When doing CPR, it's important to make sure you're in the centre of the chest, in line with the armpits, going at a rate of 100 to 120 BPM.
30.
Also making sure you've got good recoil and depth. While this is going on, you can ask bystanders for patient history, whether they saw what happened and whether they know if he's on any medications. We will continue to do CPR until either backup has arrived, the patient regains consciousness, or we're too exhausted to continue with sufficient CPR.
25, 26, 27, 28, 29, 30.
Stop CPR.